My dear fellow colleagues, my name is Abraham Peled. I'm a psychiatrist and neuroscientist, and for many years I'm trying to promote this idea of neuroanalysis. Let me explain. Neuroanalysis, which you can find literature about it on the web and also a website, is intended for psychiatrists, neurologists, neuroscientists, and psychologists. And it is intended to reformulate mental disorders as brain disorders. This looks like it is obvious that this is how it should be, because everyone agrees that mental functions have to do with the brain. But still, in psychiatry, we don't have even one diagnostic entity which relates to the brain, or which taxonomically has a brain in it. Let's take, for example, in medicine, you have a theological diagnostic system, where the name of the disease is the cause of the disease. Let's take, for example, appendicitis. Appendix is a place in the body, and the ending of itis is that it is infected. So you have a location in the body and what happened to it. When you say depression, anxiety, psychosis, whatever, these terminologies don't relate to any part of the body. The depression is not a part of the body, and to any mechanism. So what are they? They are descriptions of signs and symptoms. What are symptoms? The complaints of the patient. He says that he's depressed. What are the signs? Observation. You see that he's depressed. And this diagnostic system is because we don't have any theology in psychiatry. But I will argue that there is a vicious cycle. We don't have a theology because we don't think in terms of a theology. We should think in terms of a theology related to the brain and reformulate mental disorders again. Okay? Now, Confucius said that wisdom begins by calling things by their correct name. So, if we are not calling mental disorders by their correct name, we will never get to the wisdom of discovering the causes of mental disorders. So the first stage that we need to do is reformulate and reconceptualize mental disorders as brain disorders. And this is what I intend to do with my project titled NEUROANALYSIS. Take the whole spectrum of psychiatric phenomenology and look for advancements in neuroscience and computational neuroscience, especially computational neuroscience models, mathematical models of the brain, in order to reformulate mental disorders as brain disorders. Let me give you one example where I think there is the most literature to back it up, this idea. In psychosis, if you look up psychosis in PubMed and you type psychosis and brain connectivity, you'll see that there are many studies relating psychosis to disturbance of connectivity of neural networks in the brain. Neural networks are optimally connected, and in psychosis they are disconnected or overconnected, or there is some kind of breakdown in the organization. And we even know, more specifically, we know that the healthy brain connectivity is organized as a small world network, and in psychosis there is a disturbance of the small world network algorithm. We will go into it with further videos, but this is just to give you an example. So this is our mission. This is the mission of neuroanalysis: to take the mental disorders descriptive diagnosis, put it aside, we don't need it, and generate a reformulation of brain-related disturbances. And those who are already backed up with literature and with science, that's okay. But those who are not, that's where we go to step in and need to do it. So I think our mission as clinicians is first to make the conceptual leap and change the formulation and start talking brain diagnosis. Keep contact with my channel and look for my videos explaining this more.